Hi, welcome to the Wings LifeWise Family Workshops. This is workshop number 4, and I am so thankful you're with us today. My name is Ann Edenfield-Sweet. I'm the Executive Director and the founder of Wings, and today we have Jeannie Gallegos, who is the New Mexico WIC Deputy Director for the state of New Mexico. So she is here today to teach us about WIC and some of the other public programs that are available. I'm so excited to have her with us today. And then afterwards, we're going to have a little question and answer and learn even more. So Jeannie, welcome.
Thank you, Anne, for that warm welcome. And I'm very pleased to be here to share and provide information about the WIC program here in New Mexico. So my topic is, what is WIC? There's a lot of people that don't know what WIC stands for. WIC stands for the Special Supplemental Nutrition Program for Women, Infants, and Children. And it's been around a long time. It actually began in 1974, and Congress started this program to address major hunger issues in the U.S. There are WIC programs throughout the state. We are administered through the United States Department of Agriculture, Food and Nutrition Services. In New Mexico, we're also administered through the New Mexico Department of Health and Public Health Division. In our state, we also have independent tribal organizations where WIC can be found. So WIC, obviously, is all over the state and in all the states in our nation. Here's a map of New Mexico. So I did touch on points where WIC is. In the red, you can see all the locations. There's 41 permanent locations around the state. We also have some satellite clinics out at our 3 Air Force bases, Kirtland, Holloman, and Cannon Air Force Base. The blue dots on the map indicate where the Indian Tribal Organization WIC offices are located. We serve approximately 36,000 participants a month on the WIC program statewide. And just to give you an idea, half of all the infants born in New Mexico participate in WIC. And 25% of all 1 to 5-year-olds also participate in WIC. And WIC is actually known as the premier public health nutrition program. We're very proud of that. So you might ask, what are the requirements to qualify for WIC? And first of all, you've got to qualify as a resident. So people ask, well, what does that mean? You do need to provide proof of residency, which would be your address, not to be confused with citizenship. So you just need to reside in New Mexico. That's a misconception that you have to have citizenship. You have to qualify income-wise, so at or below federal poverty level, which is 185%. One thing that I do want to mention is that if you qualify for Medicaid, TANF, or SNAP, you will adjunctively, which means you will automatically qualify for WIC income-wise. Another requirement is that you have a nutritional need, which most of us do. If you think about your own diet, if we serve people from, with different dietary needs, such as lactose intolerance, or, maybe there's a baby with low weight gain, we do all that nutritional assessment, and then we modify how we do our nutrition education for each participant. And then on the bottom of my slide, I talk about the program categories. So you must be pregnant, postpartum 6 months after having your baby, or up to 6 months after you have your baby. Breastfeeding women also would qualify. Infants birth up to age 1 year, and children up to age 5. We're actually trying to change the federal regs to up that to age 6, which will help children get to that school age. So you might ask, is that it? Is that all that it takes for the WIC program? So what I'm going to do is it's absolutely not. That's not it. Because we are a public health nutrition program, we have a very specific vision and mission to what we do at WIC. we are a supplemental food program, but we're also a very important health program. So I'm going to start by sharing the vision of the New Mexico WIC program. Our vision is to have a major impact on improving health outcomes for our participants. We want to be recognized as a national leader and achieve excellent satisfaction as viewed by the participants and the general public. So that's our vision. Our mission in the WIC program is to provide to improve health outcomes and the quality of life for eligible women, infants, and children by providing nutritious food, nutrition education, breastfeeding promotion and support, and referrals to other health and social services. So I'm going to go into a little bit of those sections that I just talked about. So the first is nutrition education. This is a very bright slide. Just wanted to share some of the nutrition education materials that we use at WIC. We provide, most of our materials are in English and Spanish. We do have some other languages available. Nutrition education is tailored to each participant on the program. So if you're pregnant, you would get information on healthy eating during your pregnancy. If you have an infant on the program, we really talk about developmental milestones and what to feed your infant at that particular time of that first year. Very important milestones that they meet. I want to mention that for people who don't speak English and Spanish, with nutrition education and just the whole WIC process, we do provide interpreters. So, we have interpreters that speak Arabic, or we actually have a couple of Vietnamese clerks and nutritionists on staff here in the Albuquerque area that really help us with that population as well. So nutrition education is actually the pillar of our program. That's what distinguishes WIC from other supplemental food programs. So aside from nutrition education, we do lots of outreach in the community. We attend many health fairs. We attend many community events. We just try to get the word out because a lot of people don't know about our program. And our program is such a wonderful program for families. We really try to help promote nutrition, but also support families that really need that extra support. One other thing I want to mention is that we also do grocery store tours, because sometimes navigating through the grocery stores with the WIC card, which I'll be talking about in the next slide, it can be a daunting task. So we do grocery store tours as well. So on to our food package. So we are a nutrition education program, but we also provide nutritious foods through nutritional support. And as you can see on this slide, our New Mexico WIC card is there. And that is a smart card where we load food benefits onto the card. They're specific to your program category. So if you're a breastfeeding woman or a pregnant woman, you would get a specific food prescription, if you will. And we provide a WIC food shopping list with all of the foods. Actually, New Mexico has one of the most robust food packages in the nation. We offer lots of varieties of foods. We've taken into consideration cultural foods and added some of those in the food package. During COVID-19, we've also added many more selections. There was actually a shortage of foods there for a while, but thank goodness that's changed since. So, and we also added some organic options, which has really helped to entice more people on our program. Okay, this next slide, I just want to touch on the extra nutritional support that we give nursing mothers. If a mother chooses to nurse her baby, we do offer additional foods on their food package. And on the other side of the slide, it's just a graphic of some of the baby foods that we offer through WIC. But I also want to note that in addition to the baby foods that can be purchased in a grocery store, we also offer fresh fruits and vegetables to infants over 6 months so that moms can make their own baby food at home. This slide talks about what WIC provides for nursing support. WIC provides hospital-grade pumps and single-user pumps to help moms not only with breastfeeding initiation, but we also want moms to breastfeed for as long as they can. So if it means going back to work, they may need a pump to pump and then bottle feed later on when they're reunited with their baby. We also offer a lot of community support for our moms. We really want them to be comfortable with breastfeeding, which leads me into my next slide. And one of the most effective breastfeeding promotion strategies in the WIC program is our peer counselor program. And this program is devised with former WIC moms who were very successful breastfeeding. We link them up. They're actually paid on our staff. And we link them up with new moms. And it's kind of like a peer-to-peer support. Our peer counselors can make home visits. They can also make hospital visits right after delivery. They're available evenings and weekends to answer any questions that might come up to our new moms. This is a great program, and I think it's made a huge difference in our breastfeeding rates. New Mexico also has one of the best and the highest nursing rates in the nation, 83%, which is highly due to the fact that WIC provides so much support. Additional services that we provide through the WIC program is just basically if we don't have what a mom needs, we actually make referrals. So in other words, if a child needs immunizations or they don't have a medical home, we make those referrals so that they get their well child checkups and immunizations. A lot of times our WIC offices are co-located with other healthcare services, so it's just a matter of walking a participant over to make an appointment with a public health nurse perhaps. We also work closely with Children's Medical Services through Public Health and Families First, just two of many programs. We work with the 1-800-QUIT-NOW to help any moms who are trying to kick the habit of smoking. And then we do also provide medically necessary formula, which is very specific and special formulas for our infants with very specific medical needs. A lot of these are not even found in grocery stores, pharmacies, so those are special order formulas that WIC does provide for our preemies or otherwise compromised infants. And then two very exciting programs during the summer months that WIC provides is our WIC Farmers Market program. And during the months of July through October, we actually issue checks for our families to purchase fresh fruits and vegetables that are locally grown, and they can use these checks at our local farmers markets. So that's an awesome program. Another one in the summer months is our summer food service program. Most WIC offices provide the summer lunch program. And prior to COVID, we would have kiddos come in and eat their lunch at the WIC offices. Of course, COVID changed that, so it's more of a grab and go kind of service this year. So I know I went over a lot of information. What we usually do is we direct all of our participants to our website. There's a wealth of information on our website. It's www.nmwic.org, and you can navigate through all of the tabs. Everything that I covered is on there in addition to lots more information. You can find where your local and closest WIC office is. If you would qualify for WIC, you can look up income guidelines. You can actually request an appointment from our website, and one of our WIC offices will call you back and schedule an appointment for you. So I really, really encourage people to look at our website. It's nicely done, and there's a lot of information on there. So in closing, Also, I just wanted to share some exciting projects that we have in the make. So we have a benefit app that our participants can download. And on the benefit app, it shows all of the balances on their card. So that's something new in the last year. We're also piloting some online ordering and pickup at our grocery stores down south. So hopefully the larger chain stores will be on board with online ordering and pickup of WIC foods. And we're also doing the self-checkout in a lot of our big stores. I'm just thinking of the Albuquerque area, and I know Smith's, you can use your WIC card and self-scan all of your food items, which makes it a little bit easier. And so in the next year, in the past year, we've had a lot of challenges with COVID. We're still offering curbside services in a safe way so that our participants can get services in the parking lot. Most of the certification process is done over the phone. They can also upload any of the required paperwork, and it goes straight into our system. And we're also looking at enhancing our food package, always looking to better and increase the amount of foods that we offer to our WIC participants. And the bottom line is just making enrollment easier and an enjoyable experience. So I'm going to end with just a motto that I like to share in WIC. And I just want to thank you again, Anne, for including us. We say, feed them well, love them lots, your child has you, and you have WIC. Thank you. And now I'm going to just open it up for questions with Anne, and we've got Jolene Ulibadi. She's also with the WIC program here in the metro area, and we'll answer some questions that you all may have.
Oh my gosh, well, I learned so many things about this program. What it is. And in fact, I didn't even know what all the initials stand for. So now I know WIC is for women. But then the first question I have, well, what about men? What about a dad that's trying to raise the kids, the mom is incarcerated or whatever? So either one of you can answer these questions. But so is it only for women?
So we also help single dads, we help grandparents, any caregivers that are raising these children, if they qualify with those qualifications.
Okay, wonderful. So
and I just want to add, we also serve foster parents. So if you're a foster parent,
that's good.
That would also qualify you.
Wow.
If you have children birth to 1 or 1 to 5.
Okay, so now my next question is, okay, so let's just say I'm having a baby. It sounds like you've got WIC representatives in the hospital. So a brand new mother could say, my income is real low, how am I going to feed my baby? Maybe they could sign up right there in the hospital. Can people help in the hospital? Or do they have to go to your website and sign up? How does somebody sign up for this?
That's a great question.
Okay.
So actually our peer counselors are in the hospitals.
Oh,
so
okay.
They will help moms who choose to nurse their baby in the hospital. However, to sign up for WIC, we would direct them to the website, and they would find their closest WIC office and schedule an appointment. Like I said, now during COVID, and I think it's a practice that's probably going to stay, is that we would do most of the assessment over the phone, and it's a real simple process. I want to really stress that we're really working to make this process an easy, not time-consuming, because we understand that moms with a newborn and maybe a two-year-old toddler, it's not easy to go to appointment after appointment. So during COVID, we've been able to issue extended benefits. So we load the card for up to 4 months of benefits, food benefits.
Oh, wow.
So it really makes it easier for these working families to access the
now,
program.
you talked about an income level. So do they have to turn in their IRS paperwork from the year before, or how does that work?
So usually we do income within the last 30 days.
Oh, so if they haven't been working, if somebody's homeless, somebody coming out of prison, a stay-at-home mom, that now dad has disappeared or something like that. It's just, if they don't have income, all they have to do is sign something or say that they don't have any income or this is how much money they had?
Correct. And then
Okay.
we work with them, and then they qualify even more so.
Wow. So it sounds like that's pretty easy then too. Oh my gosh. Okay.
Well, and we would also want to encourage them to apply for Medicaid, because again, like I said earlier in the presentation, if a family or let's say a child is on Medicaid, that would automatically qualify them on WIC, income-wise.
So automatically qualify, but they still have to notify you that they have a new
Correct.
child. Okay.
Correct. We would still
So-
have to certify them on our program.
Right. Okay. I'm just trying to get this straight because I've never
Good questions,
dealt with
though.
any of this. Now, I've heard about SNAP and TANF. So tell me the difference. If you qualify for WIC, what does SNAP stand for and what does TANF stand for? Just for the audience, because maybe somebody's listening and they don't know these things. What does SNAP stand for? Either one of you.
Well, TANF is Temporary Assistance for Needy Families.
Okay, so
That's TANF.
families. You said families.
Families.
So now it could be dad, it could be caregiver, everybody?
Right.
Okay, so, okay, and what's the difference then between TANF and WIC?
So TANF is cash assistance, and WIC is a specific food prescription. So
Okay.
how we differ from SNAP is that we have very specific foods that are on our food list. And because WIC has been around for so long, like I said, nearly 50 years,
Yeah.
we're coming up on 50 years, we've got lots of data that shows that our nutrient-rich food package, in other words, all of the foods that are on our authorized list for purchase through WIC have to meet certain nutritional criteria. So they have to have X amount of vitamin C, vitamin D, whole
wow.
grains. All of our cereals that are on WIC, they've got to meet the whole grain and sugar amounts. So in other words, it's got to be below a certain amount of sugar. So as much as we, kids would love
We
to
like
have
sugar,
Lucky Charms,
but
we love sugar.
sometimes, yeah, we have to get those good
Right,
nutrients. Okay.
right.
All right, so SNAP. So still tell me about SNAP. What does SNAP stand for and what's the difference between SNAP then?
So the difference between SNAP is they do not have a prescription. So as long as it's a food
Okay.
item, you can purchase it with SNAP.
Oh, okay.
So something that we're working on with SNAP this year is because a lot of times we'll call families to get them on WIC, and they'll say, I have SNAP, I don't need WIC. Well, absolutely, you do need WIC, because we provide, like I said, a very specific food package that have specific nutrients that can also help with your total grocery bill at the end of the day.
Wow.
Because we don't provide meat. We provide other protein sources, but we are not designed to feed a family. We're a supplemental nutrition program.
Okay.
So that's the big difference between SNAP and
Okay, so
and
somebody
WIC.
could qualify for both then?
Definitely, and we
Okay.
would highly encourage that.
Oh, okay,
especially,
that's really important.
especially
to know.
now. I mean, studies are showing that the grocery bills have just skyrocketed since
They
COVID.
have.
And, I'm not sure when that's going to change. So for a family of 5, that grocery bill is going to be a whole lot than maybe yours or my grocery bill,
Right.
So,
Okay, now this is starting to make sense to me. So sorry, I'm a little slow, but I'm sure there's
these are-
somebody listening
these are
that
great questions.
doesn't know all these things. And then how much dollar-wise is there $500, $200 that per month that of WIC that you write up? Is there a dollar amount, or does it vary by the income level, or how does that
it
work?
varies by the program category and the specific food package. So I'll give you an example.
Okay.
If we have a kiddo that's on formula and it's regular, just non-prescription formula, their food package could be $200 for 9-10 cans of formula. as opposed to one of the special formulas that I kind of talked about in the presentation, where you've got a premature infant with very specific medical needs. Those formulas can run up to $800. And
Wow.
those formulas are not even available in the pharmacies. Those have to come from a specific pharmacy and drop ship to our
And
location.
you can do that.
We can
for
do
them.
that. And so we work really closely with doctors. That's kind of what distinguishes WIC from other nutritional food programs like SNAP, is that we really do work in partnership with healthcare and other social services. So if a mom needs a medical home, we really try hard to get her into that well-child checkup, either at public health or with one of our primary care facilities here. We work closely with our contract FQHCs, federally qualified health centers.
Okay.
Here in town, we've got First Choice and First Nations here in Albuquerque that we work closely to get to find families a medical home. Because for every dollar that you spend on WIC, I mean, it's tons of dollars saved in healthcare.
Absolutely,
It
down
really
the road.
is.
And I was thrilled to hear that I think you said 83% of women, new mothers today, breastfeed in New Mexico.
Yes, we have
Oh
some
my
of the
gosh.
highest rates in the nation.
Well, my husband used to be an airline captain, and we were based in Jamaica for about 8 years. And I did a campaign in Jamaica about breastfeeding because I had 4 boys and I breastfed them all. And people in Jamaica, they were taught that canned milk was the best thing for babies. And so they didn't have any money, but they'd go out and buy sweetened condensed milk
Right.
to feed their babies
Right.
instead of breastfeeding. And so if you're listening here, I will testify, please breastfeed. And I'm so proud of New Mexico, and it's your good work getting 83% of those moms to breastfeed, because that's absolutely the very best thing that we could do for our babies today.
And
Definitely.
we want to support those moms that are not able to breastfeed
Well,
as well.
of course,
So that's
because
how come-
sometimes, yes.
Yeah, they're not able to, but
Yes.
we do want to support the breastfeeding moms, and if you're not able to, we'll support your decision and help
Wow.
them the best way we can.
Yeah, and up to $800 a month just in formula alone. Oh, that is so amazing.
Well, and the benefits of breastfeeding, the
Yeah.
health benefits. You
Oh,
know,
yeah.
even if you breastfeed, we tell people, we'd love for them to breastfeed the whole year and beyond if possible, but even 6 months, you're providing great immunity to your baby, which is like, your own personal antibiotic that you're providing. So
That's
we
right.
really do, really, really do try to promote breastfeeding and support our moms. Nutrition is also at the top of our list. We realize that getting kiddos a healthy start early on can prevent problems down the line like diabetes and heart disease and just some really, lots of allergies that you see nowadays, So WIC really is the expert in child and infant nutrition. Lots of other programs come to us because we have almost 50 years under our belt.
And you've got all of that data and yes.
WIC saves lives.
Oh, my. And improves lives, because those children then are going to benefit as they grow up to be adults.
Definitely.
And teaching
Wow.
them those health habits and
Yes.
healthy eating, staying active.
Yes.
And another thing that we try to do is we really try to encourage our moms, because our food package is so specific. We try to help moms use those foods with recipes and ways to cook, so, and things that kids will eat. You don't want to cook something that the kid's not going to eat. So
Broccoli every night. You got to put it in a dish that they like.
definitely.
Oh my gosh, I'm so excited to hear about this program, because really I didn't know that much about it. And I'm sure there's somebody listening out there. So if you are listening to this, oh my gosh.
Come see us.
Come
We
see
want you.
them. Oh my word, sounds like such a wonderful program. And all the resources are going to be available on our website. All of the facilitators are going to have all the contact information and anything else, hopefully, that you need to know. And so I am so grateful that you were with us today to find out not only about WIC, but then SNAP and TANF and all these other wonderful programs that are out there to help you, to help your families, to better all of your lives. Thanks for being with us today.